Hey there, today we're talking about something that affects so many women. In fact, it's probably one of the number one things I hear in my menopause clinic, which is hair loss. You may be noticing that your ponytail is getting thinner, or your hair along here, or your part is getting wider, or just frankly, you get out of the shower and there's just more hair that's falling out. So let's talk about what actually is happening in menopause, why it's affecting hair growth, and then what are some solutions to actually fix this? I'm Dr. Jen, a metabolic and hormone expert, double-boarded OB/GYN and integrative medicine doctor, and I help women and men actually thrive in midlife and focus on not only their health, but also longevity. If you love this content and you want to share it more with your friends, please like and subscribe and, let people know, because I'm really trying to get this education out there to try to help you so that you can help other women, because I think that there's a very big deficit in the amount of education that we have for people to find out about perimenopause and menopause and what's happening to their bodies. So what people don't realize is that estrogen and progesterone actually is very critical for hair, and it keeps the hair in growth phase for a longer period of time. So when you're going through perimenopause, then those hormones start to decline. And this decline causes the hair to actually not be as long in a growth phase. And then so it tends to sort of fall out. And you notice that you get thinning and actually more of a part, like you can see your part, or it starts to thin along here. Or even you kind of notice the spot in the back where you have a calic is more pronounced. And some of this can be related also to the imbalance in the amount of hormones. So something called androgenic alopecia, where you sort of have more androgens than the estrogens, and therefore it sort of dominates and you get this hair loss pattern. But other things can contribute as well to hair loss when you're in menopause. So could be medications, or actually medications that cause hair loss. Thyroid problems can often develop in menopause, and that worsens someone's hair. In fact, thyroid is a very common cause of hair loss, not related to menopause at all. And women tend to develop these autoimmune conditions as they're going through menopause because the immune system is actually affected by the lack of estrogen. So that can actually be a part of. Sometimes it's genetic. Sometimes you ask your mom and she says, oh yeah, I noticed that my hair started falling out at age 45. And there's just genetics in play as well that you can't change. And then there's also issues like nutrients that affect hair. So vitamin D, that is actually the thing that changed my life. Is you can actually go back to my Instagram videos from a year ago and you can see my hair was super thin and super short, and I could not keep it in. It was literally falling out all the time. I have a thyroid problem. I've had Hashimoto's forever. And basically a couple of things I did do change. I actually stopped taking Synthroid, but that's a whole nother conversation, and doing a thyroid peptide instead. And I focused on my vitamin D. So getting adequate vitamin D and iron, believe it or not, having a vitamin D above 40 is really important for hair, and an iron level, also a ferritin level that's above 40. So it's really important that you get these vital nutrients for hair growth. So not only does estrogen and progesterone cause a problem, but again, thyroid can cause a problem, genetics, nutrient absorptions, and medications that you're taking that can affect your hair. Kind of dive into some of the things that you can do. First of all, we talked about declining hormones, so you can certainly look at hormone replacement therapy. Hormone replacement therapy restores those hormone levels back to what they were in your premenopausal days. And oftentimes that's enough for women to actually slow the hair growth down. 2, you can actually use vitamin D supplementation if you're low, or iron supplementation. Making sure those levels are adequate is also going to be critical for hair growth. Number 3, you can do things like Minoxidil. Minoxidil comes in a topical form, so you would actually separate the hair into almost like lanes and put the Minoxidil spray. And you would do that on your hair usually 2 or 3 times a week at night. You can also take oral Minoxidil. Now, both of these should be monitored by your physician, especially the oral Minoxidil, because there is side effects and it can affect your laboratory work. So you need to make sure that you're being monitored. 4, there are actually herbal options. So rosemary is something that women will put into kind of a jar with other oils, and will, similar to the Minoxidil, will actually put it along those sort of lanes, for lack of a better word. And that actually improves hair growth as well. Sometimes alma can be used, which is another amazing alternative medicine option. And now the great thing about both alma and Rosemary is they don't have the same issue related. When you stop minoxidil, a lot of women will notice their hair will start to fall out again. It's kind of works while they take it and doesn't work while they don't. So that's something to keep in mind as far as expectations of what you're trying to grow and how much hair you're trying to grow, because it will theoretically could return to having hair loss once you stop. And lastly, one of my favorite things that I talk to patients about is red light therapy. Red light therapy has some good data looking at improving hair growth. So they make red light therapy in a cap form or just frankly sitting underneath a kind of a square red light unit, but you need to use that several times a week at night to notice the growth, and it works really great in conjunction with those serums that I was mentioning. And lastly, there are some sort of lifestyle tips, right? Avoiding harsh chemicals on your hair, making sure you're using things that are phthalate and sulfate free and free of chemicals, making sure you're not too harsh on your hair, like pulling it up in ponytails all the time and being too much strain on the hair follicles, and then a balanced diet that's rich in polyphenols and omega-3s, and like I said, iron and vitamin D can also be very beneficial to help you with hair loss. Remember, menopausal hair loss is common, but not inevitable. You can change this and you can actually get some of that hair growth back. Drop a comment and let me know what your favorite hair restoration tips are and maybe something that's worked great for you.